And right now we've got 52 degrees, 52 degrees, and a very, very special guest. Now, do you know anybody that has the symptoms of a hernia? I've wanted to do a feature on this, and Bristol Hospital is one of our sponsors here in the morning, and they do a tremendous job. They really have grown. General Surgeon Dr. Daniel Scoppetta is my special guest this morning. Doctor, thank you so much for being with me.
Good morning, Mr. Davis.
You know,
I
Brad.
want to start by saying that I'm an old fan of yours, going back to the Brad Davis show when I was in high school. I still have the image of you drinking a glass of milk.
I don't believe it.
Yeah, I'm telling you.
You're kidding.
Yes, I remember distinctly. I was in my high school years then.
Where did you go to high school?
Notre Dame High School in West Haven.
Absolutely.
Yep.
I had them on. You know, there are certain high schools that I still remember.
Yep.
And, well, thank you. Thank you very much. Now, let's get to the important stuff here. I know several guys that are troubled with a hernia. What brings a hernia on?
Oh, hernia basically is a weakness of the abdominal wall. I usually refer to it as kind of a hole in the abdominal wall, usually in the groin area for most men. And they notice it because there's either pain or they notice a bulge, and they say, "What's this? Let me go to my doctor and figure out what I need to do about that."
Now, it used to be that it was from lifting. If you lifted too much weight, that would cause a hernia. Is that still in play?
Yes, that's in adults, that's really what gets things going. You know, the wear and tear of life, and the fact that there are certain parts of your anatomy that are just inherently weak, like in the groin or near the navel. That's where the most common hernias are encountered. But yes, you're absolutely right that with lifting over time, if you have a tendency to develop a hernia, then that's what will happen. And approximately 25% of all men in the United States, sometime in their lifetime, will develop a hernia.
Really?
Yeah, it's that common.
Now, what treatment options are there for a hernia? Just surgery?
Yes, actually, for the most part, the only treatment for a hernia is surgical repair. There are occasional times, depending on what the patient's condition is, that we may just watch and wait. But when it comes down to it, basically, all there really is surgical repair.
Now, let's talk a little bit about that. Dr. Scoppetta,
Yep.
General Surgeon Dr. Daniel Scoppetta, Bristol Hospital, my special guest here this morning. Now, if somebody has to be operated on, how long does the operation take, and how long will they be laid up?
Well, if we're speaking about a groin hernia, usually an operation like that is done as an ambulatory basis. You're in and out the same day. The operation usually lasts between a half an hour and an hour. And in terms of getting back to normal activities, at least what I tell my patients is that it's going to be a few days to a couple of weeks that you can get back, because nowadays we use minimally invasive techniques called laparoscopic repair, and we also use mesh to reinforce the area. So it's not uncommon for someone to have an operation 1 week and be back to full normal activity the following week.
Now, Dr. Scoppetta, working out, keeping yourself in shape, is this going to help to prevent a hernia?
Not really. It won't prevent it, because if you have a tendency to form a hernia, it probably will happen. But from the surgical point of view, it's a lot nicer operating on people that don't have too much extra tissue there. It's the healthier you are, the more likely you're going to come through the experience successfully and happy.
Is a hernia, in some cases, hereditary?
Yes. Some hernias are. I definitely, and I've been in practice for over 30 years, and I've had many family members, generation after generation, come in. But yes, I guess the answer to the question, it is a hereditary thing.
So as soon as you have this type of pain that you just described, to get checked out right away. Now, at Bristol Hospital, do you get a lot of calls for hernias, doctor?
Yes, hernias probably are the most common surgery that a general surgeon will do, and so it's one of our bread and butter things. Very common, a weekly event for us.
Really?
Oh yes.
Well, you know something, and there's no question about it. And I'm not just saying this because you are a sponsor, but Bristol Hospital has really come into its own. I think it's the from the president on down, and so many people now are going to Bristol Hospital, know a lot about it, but of course you're advertising a great deal too. But these are subjects that I cover here in the morning, subjects that I understand are problems with certain people, both women and men, but just men with the hernia. So I thank you so much. Now I'm going to give the telephone number for the hospital. The phone number and the website, my friends, is Bristol Hospital, one word, bristolhospital.org, okay? And the telephone number, 860-582-1220. 860-582-1220. Now, if somebody, Dr. Scoppetta, makes an appointment for a hernia operation, how long of a wait before you can take care of them?
Generally, it's within a week or so.
Terrific.
Yeah.
Okay, well, thank you so much for being with me, and I'm glad that you were on the dance show.
It was my pleasure.
That takes me back a few years. Okay, thank you. Bristol Hospital, General Surgeon Dr. Daniel Scoppetta, 860-582-1220. Call at any time. They're good people. 8:43, 17 minutes before